We know that the same thing that happened with Cuba can happen with any other country we seek to have a cooperation with, because our great neighbors up north are putting themselves first. And so we should be putting ourselves first as well. Are they at that table? Investigation, reduce spending. We don't really have a problem with it. If anyone was caught by surprise by the US's recent announcement of putting increased sanctions on Cuba and any country associated with the Cuban medical program, then they simply weren't paying attention. For those who don't know, Cuba sends hundreds of its medical teams, including nurses and doctors, around the world to many developing countries to provide low-cost healthcare and to supplement their local healthcare industries. Jamaica is one of those beneficiaries. In the height of the COVID-19 pandemic, it was Cuba that volunteered to send its army of doctors to nearly 40 countries around the world to help mostly poor and developing countries fight the virus. Since 1976, Jamaica and Cuba have enjoyed this healthcare cooperation whereby hundreds of Cuban healthcare workers are in Jamaica at any given point, between 250 and 300 doctors and nurses helping to supplement our healthcare system. In fact, one of the most well-known healthcare programs is the Cuban eyecare program, which provides eyecare surgeries every year to Jamaicans, mostly in rural areas. In making the announcement, U.S. Secretary of State Marco Rubio, himself a descendant of Cuban immigrants, described the Cuban medical missions as forced labor. He said the expanded restrictions would target individuals and immediate family members of those responsible for implementing the program. So that would necessarily mean like government ministers and anybody working in the Jamaican government who is responsible for implementing the Cuban medical program. Who knows if it would even include the technocrats in different ministries or even the doctors, the healthcare workers who cooperate with these people. I mean, who knows how far they would expand this to. Now, in response, Jamaica's healthcare minister, Dr. Tufton, said that the government was in negotiations with the U.S. government to try to understand the program better, or these new rules better, and to see if they could come to some sort of compromise. Minister Tufton also said that the government was looking towards the Philippines and Nigeria, both of whom also have healthcare workers in Jamaica, by the way, to help to supplement, the expected shortfall. Because I think up to at this point, he said there were around 400 healthcare professionals from Cuba currently working in Jamaica. And while I understand that there's an immediate need to fill a shortfall in our healthcare industry, so that we need to go to other countries like the Philippines and Nigeria and wherever to try to get nurses to fill that gap, I really hope that there is a long-term goal to keep our own healthcare professionals in the system. I really hope that the government is looking long-term in terms of trying to stop fighting with our healthcare professionals when it comes to the working conditions and when it comes to the salaries that they deserve. According to some studies, nearly half of all physicians and about 2/3 of nurses trained in Jamaica since 1991 have left the country. And while most were leaving for higher salaries in the United States and Canada, about 8% were going to other Caribbean islands. So it is very clear that the government knows exactly what the issue is. And if we are serious about finding a long-term solution, then the goal has to be to keep our healthcare professionals at home. Because these opportunities are not going to be available to us forever. We know that the same thing that happened with Cuba can happen with the Philippines, can happen with Nigeria, can happen with any other country we seek to have a cooperation with, because our great neighbors up north are putting themselves first. And so we should be putting ourselves first as well. Because who is to say that the government and the Philippines won't have a big spat tomorrow and then all of a sudden there are sanctions on the Philippines and nobody can do business with them? Who is to say that won't happen with Nigeria? Remember what happened with the Petro-Carib agreement? Remember how invested Jamaica was in Venezuela and the Petro-Carib agreement, and how that worked out very well for our country until the US said no more? So then the bigger question is, what exactly are our leaders willing to sacrifice to ensure that Jamaica is first? What are they willing to give up? What are they willing to do? Are they willing to speak up just like Dr. Gonzalez from St. Vincent and the Grenadines and, give up access to the great U.S. and their holiday vacations in Miami so that their citizens can have access to affordable healthcare and that their citizens can have, access to their own markets and just have what they need without being forced to undergo certain changes that are not beneficial to our people? What are they willing to give up? And we have to get to the point where we look beyond the local issues and ask our politicians to speak up for us as a country. If they're not willing to do that, then they shouldn't be in office. And so some of the questions that we should be asking them when they come to seek your vote is, what are they willing to give up to put Jamaica first? What are they willing to sacrifice to ensure that Jamaica does not get left behind and get the short end of the stick every time? And if they're not willing to give up anything, then maybe they're not fit for the office.